Hello, in this video, we're going to talk about the physiological changes that occurs throughout pregnancy. First, we will talk about the hormones in pregnancy. So here we have a pregnant lady, and the pregnant lady has a fetus growing inside the uterus. And here we are actually having a larger picture of the uterus, and we are looking at the right fallopian tube and the right ovary. The hormones in pregnancy are very important for many reasons. One is it helps maintain the pregnancy. Two, it helps prepare for delivery for the fetus to leave the uterus. And third, it helps prepare the mother for what happens after giving birth. That is, prepares the mother for breastfeeding. Pregnancy is about 9 months in duration. We are looking at hormone concentration on the y-axis. There are 3 important hormones in pregnancy that I will draw on this graph. The first is beta-HCG. Beta-HCG is the hormone of pregnancy. If this is high, it indicates pregnancy. Beta-HCG peaks just before 3 months and then slowly goes down. Beta-HCG is produced by the placenta, essentially where the growing fetus is. The next hormone I want to talk about is estrogen. And of course, where there's estrogen, there is estrogen's mate called progesterone. Now, progesterone and estrogen are 2 important female hormones, and they are part of the normal female reproductive cycle, the menstrual cycle. However, in pregnancy, the hormones, estrogen and progesterone, the concentration actually differs, and they have a more of an important role throughout pregnancy. So let's talk about estrogen. Estrogen is produced initially by the ovaries, the corpus luteum within the ovaries, but then the placenta will take over the job. Estrogen will continuously rise throughout pregnancy. The next hormone, important hormone, is progesterone, which I mentioned. And this again is initially produced by the corpus luteum within the ovary. But then the placenta has the main role later throughout pregnancy. Progesterone rises continuously throughout pregnancy as well. However, before birth, before parturition, before the baby leaves the uterus, the estrogen and progesterone levels actually drop. And this allows for labor. It allows for birth. Throughout pregnancy, estrogen actually helps prepare the maternal body for delivery. It does this by increasing the number of oxytocin receptors in the uterus. We will look at the other functions of estrogen throughout the video. Progesterone's role in pregnancy is actually it works as a smooth muscle relaxant, and it maintains the uterine lining. And we'll talk more about progesterone in this video. In summary, there are 3 important hormones in pregnancy to remember: estrogen, progesterone, and beta-HCG. The physiological changes in pregnancy, it relates to many things. It relates to the hormonal changes in pregnancy, the changes in anatomical structure of the uterus as it grows and fills the abdominal cavity. And the physiological changes in pregnancy also relates to the growing fetus, the increase in demand for nutrients, for blood, etc. Let us look at these physiological changes by focusing on body systems. So let's begin by looking at the physiological changes in pregnancy, beginning with the respiratory system. The respiratory system is important in delivering oxygen around the body and also removing carbon dioxide, which is the waste, out from the body. In pregnancy, the uterus enlarges, and this will cause an increase in intra-abdominal pressure. As a result, there will be more of a diaphragmatic breathing in a pregnant lady. Similarly, because of this mechanism, there is hyperventilation and an increase in tidal volume during pregnancy. Cardiovascular changes in pregnancy include mainly there is an increase in cardiac output because there needs to be more flow to the placenta. The increase in cardiac output is a result of increase in heart rate and an increase in stroke volume. In the vascular system, there is a drop in resistance. There is a drop in resistance in the vessels, which actually contributes to the increase in stroke volume of the heart, and thus the increase in cardiac output. During pregnancy, there is actually a drop in blood pressure usually. If there is an increase in blood pressure in pregnancy, it is therefore most likely abnormal. An increase in blood pressure during pregnancy can be due to many things, but one thing to consider is preeclampsia. Hematological changes in pregnancy. We see an increase in plasma volume by 40%. The increase in plasma volume is actually what contributes to edema. So in pregnancy, peripheral edema is actually a normal feature because of the increase in plasma volume. The other important hematological change is there's an increase in red blood cell volume by 25%. This is important to take into consideration because the two changes we just talked about actually lead to anemia in pregnancy, which is another common finding, anemia. This happens because there is a much larger percentage increase of plasma volume compared to the increase of red blood cell volume. This means that there is a net less number of red blood cell per volume of plasma, thus causing anemia. Further, in pregnancy, there's actually an increase in clotting factors, and thus pregnancy is a hypercoagulable state. This is actually kind of dangerous thing because a common complication during pregnancy is deep vein thrombosis, and deep vein thrombosis should thus be on the radar of many health workers. The musculoskeletal changes seen in pregnancy is usually a result of the uterus growing, the uterine enlarging. As the uterus grows, there will be changes in the abdominal cavity, and this will contribute to some of the following findings. We see an increase in body mass index. Throughout pregnancy, it's normal to gain between 10 to 15 kilograms. There will be presence of stretch marks, lower back pain, lordosis. There's an increased risk of developing carpal tunnel syndrome, sciatica due to compression of the nerve around the buttock, upper thigh, and as well, muscle cramps are also a common feature in pregnancy. The endocrine changes we actually already touched on. We talked about the important hormones throughout pregnancy. However, during pregnancy, there is also an increase in anterior pituitary gland function. And so there's an increase in anterior pituitary gland hormone production and also hypertrophy of the pituitary gland. There's, of course, the pregnancy hormones, again, which we talked about, estrogen, progesterone, and beta-HCG. The other important hormone that is produced by the placenta during pregnancy is human placental lactogen. And the human placental lactogen actually has a relationship or an association with the development of gestational diabetes, a complication seen in pregnancy. The production of thyroid hormones are also increased during pregnancy. Hyperthyroidism, thyroid hyperplasia, and goiter are not uncommon features seen in pregnancy. Finally, dermatological changes in pregnancy include increased skin pigmentation, distension and proliferation of blood vessels, spider angiomata, striae gravidarum are essentially the stretch marks seen in the belly of a pregnant lady. Let's now focus on the female reproductive changes in pregnancy, and this is very important. Let us cut a cross section of the body, sagittal section, and we're looking inside the abdominal cavity where the uterus and fetus are. The gynecological changes are mainly due to the increase in estrogen, progesterone, and the growing fetus. These changes include breast enlargement, areolar pigmentation, uterine hypertrophy and stretching by up to 10 times the normal size. There is the cervical gland hypertrophy, which causes the increase in mucus secretion at the cervix and thus the development or formation of the mucus plug. And again, this is actually the result of estrogen. Estrogen also has an important role in that it actually causes the vaginal lactobacilli proliferation. These are bacteria found in the vagina, and the proliferation of the lactobacilli actually causes an increase in lactic acid in the area and thus decreases the pH of the vagina. The lactobacilli are thus, you can think of as being protective or protectors of the vagina canal and protectors of the uterus. And this is because they create an environment which is unfavorable for other pathogenic bacteria and microorganisms. The breast changes in pregnancy are very important because it prepares the breast for breastfeeding. What happens is that estrogen will cause increase in adipose tissue in the breast tissue, making the breast more large. Estrogen also causes the lactiferous duct system of the breast to form, to proliferate, and to arrange itself ready for breastfeeding. The other hormone, progesterone, actually causes the breast lobules to enlarge. Zooming into the breast lobules, these lobules contain cells which actually produce the milk. And these milk will get secreted into the lobule lumen. The lobule itself is surrounded by myoepithelium. The myoepithelium is what is responsible for contracting and thus injecting the milk through the lactiferous ductal system and then out. So just remember, progesterone is important for the breast lobules formation, and estrogen is important for the breast ductal system, so the lactiferous ductal system. It's important to remember this because it also relates to breast cancer. The urological changes seen in pregnancy. The main one is that we see a renal blood flow increase by up to 40%, and this correlates with the increase in cardiac output. When there is an increase in renal blood flow, this also means there's an increase in the glomerular filtration rate. And thus, because there's an increase in glomerular filtration rate, there will be more urinary frequency. So there'll be more frequent urination. The kidneys also become enlarged to compensate for this increase in renal blood flow. The ureter also dilates because of the smooth muscle relaxing effects of progesterone. In the gastrointestinal system, there are many changes. The main ones is the esophageal sphincter relaxation, and this contributes to the reflux seen in pregnancy. This again is actually caused by the smooth muscle relaxing effect of progesterone. Remember that the uterus is also growing in the abdomen, the abdominal cavity. This will cause an increase in intra-abdominal pressure, which actually also contributes to the reflux. The increase in intra-abdominal pressure also contributes to the formation of hemorrhoids in pregnancy. Finally, in pregnancy, there is also reduced bowel motions, meaning constipation. And this again is a result of the effects of progesterone, which acts as a smooth muscle relaxant. That concludes this video on the physiological changes seen in pregnancy. I hope you enjoyed it. Thank you for watching.